Hi, everyone. I'm Jim Hendrix, the Chief Scientific Officer from LuMind IDSC. And we at LuMind IDSC would like to thank you for your generous and continued support. Your support throughout the years has had a profound and lasting impact on our vision and shared mission here at LuMind. Throughout the course of the global pandemic, our community has proven itself to be stronger together, and part of our strength comes from your generous donations. It is because of our donors like you that we can fund incredible research initiatives like the T21RS survey on COVID-19. So let me tell you a little bit about some of the things we've learned from this survey. It's been highly important and impactful. We've looked at 800 cases of people with Down syndrome all over the world who've contracted COVID-19. And while that seems like a lot, there's still a lot we don't know about this disease and how it affects people with Down syndrome. But let me tell you some of the things we have learned. It appears that people who become hospitalized due to COVID have some things that are very similar, whether they're in the general population or they have Down syndrome. So some of these symptoms include fever, cough, or shortness of breath. These seem to be common whether you have Down syndrome or not. A more frequent symptom, though, is altered consciousness or confusion. That seems to be more common in people with Down syndrome than in the general population. And a less frequent symptom that's seen in Down syndrome as opposed to the general population are things like joint and muscle aches, joint pain and muscle aches, or vomiting and nausea, which appears to be more common in the general population than in Down syndrome. We've also learned that there are major medical complications due to COVID-19, and more frequent of these complications are lung complications, including viral, bacterial, and pneumonia, or acute respiratory syndrome. These can be very serious and should be taken very seriously by physicians and by family members. Other serious complications have a similar frequency whether you have Down syndrome or not. These include heart complications, kidney problems, or anemia. Now, the thing that people are most concerned about, of course, is mortality or death due to COVID-19. Now, it is true that people with Down syndrome have died from COVID-19, and we have documented many cases. But overall, the rates are still relatively low, but we have learned that just like in the general population, the older you are, the higher your risk of death. So those 40 years of age or older with Down syndrome have a 2.5 higher risk for death due to COVID. And this is beyond the presence of any pre-existing health conditions that they may have had. So we need more data, but it does look like in the general population, younger people and children tend to have lower risk. Now, it doesn't mean the risk is zero, because we have seen a few cases of children with Down syndrome who have died with COVID-19, but we need to learn more about those causes. So we think that our community, that you in the Down syndrome community, have done a great job of protecting those people that we love with Down syndrome, with social distancing and with mask wearing and other preventative measures to keep them safe. And we hope that you continue to do that. And at the same time, we will continue to study COVID-19 and its impact on the Down syndrome community. So with that, I just want to close by thanking you once again for your continued support of LuMind IDSC and our research initiatives. It is people like you that truly make us stronger together.